we are gonna, got it. We are gonna go ahead and kind of talk through kind of setting the stage for the legislative landscape for LGBTQ plus rights in Missouri. I think with some of the folks on the call, you will have some background already, some won't. If you all want to take a quick moment just to do introductions in the chat as well, I would love to know folks' names, your pronouns, and where you're joining us from. So we have a sense of if people have experience with our work, or if we're partners with your organization or your particular faith community. So I'll set the stage a little bit, talk with you about how that stage kind of creates the call for us to have Promo's mission and vision. I'm going to go through some of the challenges that we faced this year, and then talk through strategy, approach, kind of successes to celebrate, and then next steps. And the next steps really speaks quite well to the importance of the work that SQSH does, the importance of the work that MTUG does, because we really focus at Promo on the macro level systems change, and my colleagues on the call get to work more on the one-on-one and community building work. So thanks, I see people are starting to put their names in the chat. Thanks so much for doing that. Good to see where folks are joining from. So at Promo, we work really to protect and advance LGBTQ plus equality. The reality is that we live in a state without non-discrimination protections. And when I speak with people, across the state, many Missourians simply aren't aware that one can be fired, denied housing, or a loan because of our sexual orientation or gender identity. In an ideal world at Promo, we'd be leading the charge on inclusive pro-LGBTQ plus policies. We're in a place where we are able to lead those pro-LGBTQ plus efforts, but we're constantly forced into a space where we're reacting and responding to pretty unrelenting gratuitous attacks on LGBTQ plus youth and communities. And I think it's important to just name it. There's no question that select conservative politicians are using transgender youth as the latest wedge issue, one of the latest wedge issues, I should say, to really fuel culture wars, and we have to fight back. I will say that the municipalities in Missouri, including St. Louis and St. Louis County, where it looks like a lot of you are from, have created this patchwork where there is protection and there is non-discrimination protection that covers about 20% of folks in Missouri. And so, our work happens in big and small ways at the state level, as well as at the muni level across the state. So just to share our mission and our vision, in case it's something that you are not familiar with, we envision Missouri as a state in which LGBTQ people, every demographic, race, ethnicity, zip code, and experience are valued and thriving. That's the future for which we hope. And the work that we do to get there is we confront systemic inequities to liberate the full spectrum of the community from discrimination and from oppression. That's a renewed mission and vision that we embraced just a couple of months ago, and I think really speaks to the call to be intersectional in our work and in the coalitions that we build. So I want to talk a bit about the challenges that we faced this year in the legislative session and give a little bit of a debrief there. So we saw 18 bills filed, 7 amendments and 2 bill substitutions that explicitly attacked the LGBTQ plus community in Missouri this legislative session. They looked at taking away marriage equality, the ability to change your gender marker or name on your birth certificate. What you heard about in the news the most was taking away children's ability to play sports according to their gender identity. But most dangerous, and the rhetoric that I think caused the most harm, was the bills that were written to ban access to life-saving, gender-affirming healthcare for trans youth. We also saw bills that were really about like voting access and limiting folks' ability, restricting in particular access for trans folks if their ID did not identify with the way that the poll person perceived them to be presenting as well as LGBTQ plus inclusive school curriculum. I will say in good news that there were 14 bills and 4 amendments that attempted to further protect the rights and liberties of LGBTQ plus Missourians. And that also involved, inclusive curriculum, the ability to change gender markers, MONA, the Missouri Non-Discrimination Act, the Crown Act, and particular harm reduction and needle exchange programs that Promo was able to work really closely with folks on. We track about 200 bills in a legislative session because of recognizing the intersectionality of issues, that these bills all have negative or positive impacts on our community. So these bills were filed, December 1st, and then we were in the session January through May. But I want to kind of explain like a dynamic that happened. Very frequently, we would get no notice at all that a bill was going to come up for hearing, and we would be given 24 hours and literally 5 minutes. And I am not exaggerating, 24 hours is the minimum amount of time required to give notice of a public hearing, where it was very clear that while we were given 24 hours and 5 minutes, our opposition had shared with folks that they were able to fly in from across the country to try to defend their bills. I share that example because there's a very well-organized, very well-funded, I call them dark money, and I don't think that's the best phrase, but very organized, well-funded group pushing this legislation forward with the singular focus of getting reelected and consolidating very conservative power. So those are kind of the heavy, big things to share. But the other things that I do want to kind of make sure that is that we also were able to organize and testify against these bills in education with our voter rights coalition that we belong to, and in particular organized families around transgender healthcare bans and athlete bans. The strategy that we always employ starts with community engagement. And we have a really extensive, broad-based network of partners that we work with under the dome. But it really starts with team building and building our team building relationships with elected officials. So we have a contract lobbyist that lives in Columbia and is in Jefferson City every single day. We also have a lobbyist on our team. Many of you have probably heard from Shira Berkowitz in the past. Shira is our Senior Director of Public Policy and Advocacy, and they are leading Camp Indigo right now. So they're not here to join us for this call. But if you don't know about Camp Indigo, check it out. It is awesome and something that Shira and Rabbi Daniel Bogart have worked on for quite a while. And it's an LGBTQ plus camp, overnight camp for youth. So it's been really hot for them as they've been out there, but I think that it's also been a really beautiful experience. So Shira does a lot of that direct lobbying and relationship building. Then our team members are focused on coalition building. So locally, with the ACLU Missouri, with folks at NCJW, JCRC, Chambers of Commerce, Pro-Choice Mo, we work very, very closely with the sexual and reproductive health folks. And then nationally, we have a tremendous amount of support where we worked with Athlete Ally, the Trevor Project, and Equality Federation on our bills in particular, because Missouri is a state that has been prioritized for our networks to support us as well because of the attacks that we faced. And the last couple of things I think, if you're on this call, you're familiar with, it's, the work we do to mobilize community and to focus on community education. So the successes to celebrate from this year, which it's in the month of Pride, even when things can still feel heavy, so important to celebrate the successes and the joy. Transgender youth in our state today, right now, have every right that they had before legislative session started. That means that as a community, we all stopped 18 attacks on trans youth and LGBTQ folks in Missouri, and that is something to absolutely celebrate. Most conservative states and the leaders that are in the same position as I am, but in Texas and Arizona and Florida, and I was with many of them yesterday, are not able to say that. And there's a number of reasons that we were that successful. One of them is the incredibly resilient community that we work with. One of them is really brave parents who stand up and fight for the rights of their children. One is youth who stand up and fight for their own rights and speak truth to power and under the dome. But another is that the kind of extreme caucus of the conservative caucus this year, which was a small but powerful group, was unable to work with moderate Republicans to get their agenda across. And we work very closely with moderate Republicans to make sure that we are creating affirming and inclusive spaces and not doing harm, because the reality is the moderate Republicans that we work with don't want to do harm to LGBTQ youth. And I want you all to know that. We have many friends in Missouri under the dome, and that's important to know. Some other things to celebrate: Medicaid expansion was fully funded. Mona gained more support this year than ever because we were actually able to see a vote on the floor via amendment, not on the standalone bill. But that's really important to be able to capture that. St. Louis County Council expanded their protections to include gender expression, which is a really big deal. And that's something that Promo was able to assist. Shira in particular led that work. And we're working with additional municipalities to follow. So really important, successes to lift up, and just want to celebrate the community and all of you that were able to do that. So next session, the challenges ahead. We know that the attacks on trans youth are not over. We know that they're not just going to kind of disappear. This is a midterm election year, and so I do think that the attacks were worse than they probably will be next year, but who knows? I don't have the crystal ball. If any of you do, call me and we'll talk. But it will be a significant amount of work again next year. There's no question. And Jen asked if any of us could speak to kind of where does the overturn of Roe have consequences for the LGBTQ plus community? And the easiest way for me to really talk about it as someone who is not an expert on this is really to talk about how the vulnerable within our community are going to be the most impacted. So folks who already have limited access to healthcare, folks who already feel as though they're not safe to be seeking the treatments that they need, and folks that have been told that they do not have value are going to be markedly impacted, especially in a state like Missouri. We know that the strategy has been long. If the court overturns Roe and Casey, it would upend individual constitutional rights that Americans really broadly support and have relied on for half a century. So it's truly alarming, and we should be pushing back. We are pushing back. But until we see a final decision, I think it is the responsible thing to say that abortion is still legal in Missouri right now. And I want to make sure that we repeat that. There's so much at stake, and the fight will continue in state courts and legislatures as well as in Congress, I'm sure. But something that comes up a lot in the space that we work in is Obergefell. And I do want to be clear that I am not an expert on this, but that I was totally spoiled and got to be at this amazing event yesterday at the White House, where Biden signed an executive order to increase protections for LGBTQI Americans. And Jim Obergefell was there, and it was addressed that Obergefell does not fall with the reversal of Roe and Casey. Marriage equality remains the law of the land, and these rights, they're fundamental rights that right now are secure and not subject to political pressures or changes in government personnel. I know it's really scary though, and so I recognize that there are very realistic fears, but it is not the domino, I don't think, that folks maybe are believing that it could be so quickly. And again, I work in state legislative politics. I don't work in courts or the federal government, but I want to recommend, if you're curious to know more, that you hear from someone who has given this a tremendous amount of thought. Promo works really closely with the ACLU of Missouri and ACLU nationally. And ACLU has a podcast called At Liberty, and Alok Vaid-Menon has been interviewed very recently after the death of their aunt, and Urvashi. And it's a really beautiful interview, but it speaks to this particular question, Jen, that you brought up for us. And I can send this, Jen, or, when I'm not talking, I'll put it in the chat and people can go directly to that podcast. It's a really, really beautiful piece. And if you're someone who thinks about gender, who would like to know more and maybe has curiosities about gender binary and kind of the colonization that maybe has reinforced gender binary as well, it's a really beautiful podcast to listen to. So I'll put that in the chat in just a minute. And then last thing for me, and I will hand it over to my colleagues at Squish and MTUG, people like to know after I share kind of what's going on in the Capitol, what can I do? And I think it's really important to tell your friends about our work. if marriage equality taught us anything, it's that we need education from peers and families to change hearts and minds and laws. And if you don't know a trans person or think you don't know a trans person, to make sure that you talk with my colleagues who are on the call and make sure that you humanize and personalize an issue, just like we did for marriage equality, to make sure that the individual autonomy, health, and wellness of our trans community and trans family is centered. But we just have to have those conversations. If you'd like, you can sign up for our legislative action alerts. I'll put those in the chat as well. And then I couldn't be more grateful to have Luca and Michaela doing the direct service work that they're doing in the community. And so I just ask you to support the life-saving work of MTUG and SQSH. We will keep doing the policy stuff that we can, but we are working within a system that was never built to serve LGBTQI+ folks. And Luca and Michaela get to build their own systems, and they get to work within that. And it's like so inspiring, and they liberate people every day. And I'm very grateful for their work. So I'm going to put a couple things in the chat and I will pause there. But thank you for letting me create the kind of landscape for why their work is so important as we celebrate Pride Month.
Thank you so much, Katie. I guess I'm wondering if we could have some direction from Jen about whether you want either me or Michaela to go next, or should we pause a little bit for questions, comments?
Does anyone have any questions for Katie before we move on? And Luca, you're welcome to go next.
Michaela, how are you feeling about that? Okay. Well, thank you, Katie. Also really appreciate the shout out because all of our work is interconnected. So I really appreciate the approach to relationship building and coalition building that Michaela and Katie bring. With that, I would like to be made co-host so I can screen share my slides.
I think I already did, but if I didn't, let me do it again.
Mm-hmm. Thank you.
Maybe it doesn't stick.
Okay. All right, can folks give a thumbs up if you can see the words on the screen clearly? Okay, thank you. So I would say that my presentation today focuses on queer terminology, mental health, and the power of peer support. I'm Luca. I use they, them pronouns. I'm the co-founder and executive director at SQSH, the St. Louis Queer Support Helpline. If you haven't heard of SQSH before, that's very normal because we are a very new grassroots community-based organization started in 2019. So we're only 3 years old in the span of our organizational life cycle. We're really at infancy, but that also gives us the opportunity to build our own systems, our own structure, and figure out what the next stage of growth will be like for us. So today I'll cover a little bit about SQSH's founding, mission, and programs. Our peer support helpline is a potential referral for you, your friends, and family. So I'll share some information about that. And for those who are curious, I'll share a little bit more about our training curriculum, what other programs we offer, some ways to support and collaborate, and then definitely want to encourage interactions and questions throughout. So I would love for folks to share, have you heard of SQSH before this presentation? Let us know in the chat. And yes, we are called SQSH. So you can say that. And squish is also a queer platonic crush. So it's a way that asexual and aromantic people have developed a term to describe attraction to people that's not rooted in sexual attraction or romantic orientation, because platonic, intellectual, emotional, and other forms of attraction are just as valid as sexual and romantic attraction. So just a neat little term to share today. I'll share a little bit about my story as well and why I'm motivated to do this work. So I'm a transmasculine, genderqueer person born and raised in Singapore. I grew up feeling really isolated, stigmatized, and afraid because Singapore is a highly conservative country. It's also a semi-authoritarian regime. So a lot of the rights that citizens have in the US, including the right to free speech, to petition your government, to demonstrate, are not rights in Singapore. There is only one place in Singapore that you can demonstrate in. It's a park, and it's a tiny park, and you have to get a government permit to demonstrate in it, which kind of defeats the point if you're trying to demonstrate against the government. So I use that example to share that growing up in that environment, I think I experienced the intersection of like lack of civil and political rights with being queer and being trans as a closeted young child and then young adult. I didn't have any queer role models to look up to. I didn't really have any supportive peers to talk to. And whenever there was any conversation about LGBTQ topics in school, it was always very kind of hush-hush, stigmatized. And kind of when rumors went around that I might be gay or bisexual, I squashed them very quickly, because to be perceived as queer in Singapore, especially as a kid, was very much social suicide. So I only found the courage to come out when I came to college in the US, which I had the privilege and resources to do, to immigrate to this country. So Squish is a resource I created that I wish I had growing up, which is a confidential, non-judgmental LGBTQIA peer support resource and network. It's also important to me, though, that Squish has the capacity to provide not just direct services, but use them to inform advocacy and education work towards systemic change, which is why we partner with organizations like Promo and MTUG to make sure that the direct service work we do is not just a Band-Aid solution. Because if we take hundreds of helpline calls for the next 30 years, we are providing support and healing in the moment, but levels of violence and discrimination overall may not change, which means that people will be calling back for the same reasons, because the root causes of oppression still exist. So my style of presentation is I like to facilitate more interaction and discussion. So I'm going to pause here and ask if anyone would like to share in the chat or verbally what motivates you or brings you to this work. So I just shared a little bit about my story, but I would love to hear from others. And if there's awkward silence, I would love for Katy or Michaela to share.
I'll break the awkward silence.
Thank you, Leslie.
My name's Leslie Hoffman, and I have a non-binary child. So very interested.
That's awesome. I'm curious, Leslie, if you'd be willing to share more about how your non-binary child motivates you to participate in this space.
They let me know about issues, and they educate me about, obviously all our children are very, very eager to school their parents on any subject. So yeah, and they do it in a, respectful way. They also have made me aware of different organizations in St. Louis. Let's see. They also made me aware of all, of course, the legislative issues that are going on in Missouri as they happen. And I'm very motivated to get more involved and, in more of a, definitely in more of an active way. I think that we have special challenges in this state on a lot of different levels that need to be addressed, and doing nothing was really not an option anymore for me.
That's really inspiring to hear, Leslie. Also, your kid sounds great.
They are.
Very inspiring. I've also heard Katy mention that being a parent also motivates their urgency for this work. And I'm wondering if there are any other parents or people with queer family members or friends in the crowd who would like to share. Yes, go ahead.
By way of networking only, since no one else has stepped in, I wondered, Leslie, if you know of the lobbying work that Rabbi Daniel Bogart and Rabbi Rory Picker-Niece have done, as well as the incredible hard work that Rabbi Micah, I'm losing my concentration, but anyway, Bak Yael, that's it. They're the only ones I know of right now in the Jewish community, but I know each of them is very intense, and whatever they're doing full force. And I don't know Jen or who am I looking for? Katy. I don't know where the hierarchy of organizational entry is, but just because I'm a networker that, I know this person and that person, so you need to know them too. I'm just suggesting those three adults are very involved with this, and I don't know you, Leslie, so I don't know if your roads intersect with theirs, but I just thought I'd throw it out in case anybody needed to hear it.
And NCJW is always down in Jeff City as a support. Obviously, we are not the lead organization, and we let the LGBTQ organizations take the lead, but we are always there to support. So if you want to get involved with us and the other organizations, either way.
Yeah, absolutely. So NCJW is always present at the hearings that we're organizing folks to testify for. Rabbi Dan Bogard is almost always there, and if he's not, CRC is always showing up in big ways, sometimes just because people want to be there and offer strength in numbers. Rory is often there testifying as well, but Rory is often testifying in other hearings at the exact same time, right? And so we're pulled in many directions. But would you mind sharing the third name? Because that is not someone who I have worked with before, and I am confident Shira has, but they are not on the call. So I just wanted to capture it. Thank
Rabbi
you.
Micah Bakyael, and I believe he's employed. Where is he? There's an organization, Keshet. Isn't he with
Oh,
Keshet?
sure. Okay.
There you go. Hannah knows. Thank you. But he's local as well. So
Great.
I appreciate all of the networking and relationship building that's happening. And I just want to ask if either Jens want to share more from your contributions in the chat. Jen Bernstein says, because it's the right thing to do, I have several queer and trans family members.
Sure, I just didn't want, because I feel like I'm talking a lot. My uncle my uncle's gay. He was he grew up in a time where there was a lot of pressure to marry a woman, and he married a woman and was married for 20 years. And, we're grateful because he has 3 wonderful daughters. His grandson is trans. And he was also he retired a while back, but he was one of, and I remember when we had the previous executive director from MTUG come and do a lunch and learn a few years ago, and he had mentioned that there were only at the time 4 doctors who they would recommend people who are seeking medical care would go to, and my uncle was one of them. So that made me really happy. What was interesting to me is my uncle who was one of the 4 doctors, was having a very difficult time with his grandson being trans. And I thought that was really interesting. And again, he's in his 70s, so it might be a generational thing, but his daughter, who's my trans cousin's mom, is very smart. She's a doctor herself, and she knows what she's doing, and they're raising their son the right way, and they're being supportive, and and he's coming around. But it was just really interesting for me to see that.
Yeah, that definitely sounds really complicated, and I really appreciate you sharing that, Jen. I wonder if Jen Newmark would like to share more.
Yes, hi, I'm Jen Newmark. My pronouns are she, her. And last year, one of my kids came out as non-binary. At the dinner table, just totally unrelated topic came up, what are pronouns? And we went around the table giving examples of pronouns and what our pronouns are. I am in the art community. I'm a design student right now. And there's a lot of intersection in the art community. And because of COVID, we haven't been in a lot of places with other people, so we miss that connection with community. And when it came to this kid's turn, they used they, them pronouns. We knew something was up for a while. I've been a longtime supporter of the queer community. And when my 8-year-old tells me their pronouns, it's time to step it up to make the world a better place for this kiddo.
Thank you for sharing, Jen. That was really inspiring as well. And as a running joke, that all the queer kids are in theater. So definitely there's a big intersection, I think, between spaces where folks are allowed to express themselves and folks with marginalized gender or sexuality identities. All right, appreciate the personal sharings here. And I think from the stories we've shared so far, we know that they're both extremely unique and also common across the community. The St. Louis queer population faces higher rates of violence, discrimination, housing insecurity, and substance use, as well as medical, mental, and sexual health disparities. We also face additional barriers to accessing the identity affirming resources needed to meet those needs, which creates a catch-22 cycle when health disparities exist, but the resources that exist are not existing or created to meet or address disparities, then the disparities continue or deepen. So nationally, we know that LGBT youth are almost 5 times as likely to have attempted suicide compared to heterosexual youth, and 40% of transgender adults report having attempted suicide. Locally, at least 2/3 of the trans community in St. Louis do not have their mental health needs fully met, according to a local survey by Trans Education Services. These may feel like statistics on a page, but on a day-to-day level, what does that look like? It means that almost everyone I know in the community knows a trans person who has died by suicide, some often recently. And what this often creates is a cycle of grief that doesn't stop. So it sometimes feels like when we've lost someone that we're still grieving this person and then something else happens again. So in terms of emotional health needs, we know that 1 in 7 LGBT Missourians reports experiencing discrimination in the workplace, and 61.6% of Greater St. Louis respondents have experienced violence or victimization due to homophobia over their lifetime. Something else I point out too is, especially with the more outdated surveys, or even in the last 10 years, a lot of surveys conflate gender and sexuality. So a survey or finding might refer to the LGBT community, but actually only be studying LGB respondents or be examining rates of homophobia instead of transphobia or other forms of queerphobia. LGBTQ students in the South and Midwest have more negative school experiences overall than students in the Northeast and West. So this indicates some of the unique challenges we face as a region, including higher rates of biased language, victimization, and anti-LGBTQ school policies. One thing I like to do to bring these statistics to life is to share stories and anecdotes. So I know also sometimes it's easier to humanize issues that way. So I'll share here 4 stories that we collected when we were doing a needs assessment when we were founding Squish. The first here is from Jamie Hellman at Trans Education Services, who says, only a local helpline would know who's culturally competent, like if the nearest ER is a Catholic institution with a poor track record for serving trans people. My close friend was counseling a trans person on the edge of suicide. When checking into a hospital, they were misgendered, dead named, and treated contemptuously. They attempted suicide 2 weeks later. Having trans and queer staff helplines matter. So I think beyond the point here about helplines, the broader point here too is that having resources that are staffed by people who understand a community's specific experiences is really important. And often that means we look for queer and trans leadership or staffing when we're figuring out what resources we can safely refer someone to. I'm going to pause here and ask if anyone knows what being misgendered or dead named means, and if someone can share what do you think those terms mean with the group? So the question is, what does the term misgendering and the term dead name mean? Jen?
Yes, so dead name is using the name, like a birth name of a trans person who has changed their name. Misgendering is using like a birth gender instead of the person's true gender.
Yeah, great definitions. Thank you, Jen. I will add to that misgendering someone can look a lot of different ways. It might involve using gender terms to refer to a whole group. So everyone, like ladies in the room, or since we're all men, we know that, or hey, bros or dudes, what's up? Even in these very informal ways, if we kind of refer to an entire group of people with gender terms when we don't know their gender, that's a very maybe people consider that a mild form of misgendering. Sometimes misgendering happens unintentionally, but when it happens systematically, consistently over time, it can create really a lot of feelings of distress and feeling invisible or unseen for someone. I'll share this next quote here from Jordan at Pride STL, who says, "Shelters are not culturally competent to handle trans people. They make you live with people based on your sex assigned at birth." Sometimes we also say gender assigned at birth. Trans clients have to worry about untrained staff as well as people in the shelter. It feels unsafe. The trans queer flat is a great model, but we probably need 5 more. Since then, the trans queer flat has closed down, which leaves trans people with no explicitly trans affirming housing options in St. Louis. Most shelters are segregated by binary genders, or the entire shelter is only for a specific gender. Even if there are non-discrimination policies in place, when people are discriminated against, it takes resources to enforce their rights. So people often don't report, especially if they're unhoused or experiencing housing insecurity. So all to say, I think there's a disconnect between shelters that want to be inclusive of all genders and the day-to-day implementation and how much training and understanding staff actually have. And then just in general, the entire shelter system being segregated by gender, it's something that's hard to change overnight and something that we found to be difficult to push against. All right, I'm almost at time. I want to make sure Michaela has time for her part. So I will just briefly go over what Squish does. We founded Squish because we realized that while national LGBTQ hotlines like the Trevor Project and the Trans Lifeline exist, only a local network will be familiar with the St. Louis context. So locally, culturally competent resources, intersectionally vetted resources, wraparound services that can holistically meet a caller's needs. So just to give a very specific example, if a caller in St. Louis called and asked, I'm a queer young person, I want to find some local queer community and literature, but I can't let my parents know what are some local libraries I can go to. That's not something that a national hotline would necessarily be able to know, the kind of fine-grained, granular day-to-day experience of what it's like to live in St. Louis. Unlike traditional hotlines, we also offer a range of emotional support services beyond crisis intervention. So we also noticed that the mental health system is saturated with crisis intervention resources, but not enough crisis prevention resources. So peer support, holistic health, day-to-day well-being are not states of and experiences that our society values or like dedicates resources to, and oftentimes people only get help when they've reached a point of crisis. So Squish's existence as a peer support resource is meant to advocate for callers to call even if they feel like they're not on the brink of emotional breakdown, and also to advocate for more resources dedicated towards mental health, holistic health and well-being, and not just not being in crisis. So the last thing I'll share is just that our mission is to serve and strengthen the queer community in the metro area and beyond by providing empathetic listening, connections to resources, and education and advocacy for queer and trans needs. To achieve our mission, we run 6 programs, including our peer support helpline, our Squish Book resource database, call data analysis and advocacy, training for partner organizations like this one, education for the queer community, and we engage over 60 volunteers in grassroots organizing. I'm out of time, so all of the information on our peer support helpline is on our slide deck, and I encourage people to look at our flyers and share information, including about our opening hours and how people can access the service. You can support our work by spreading the word about us as a resource, donating, volunteering, directing potential funders, partners, training providers, interns to Squish. And we're also currently developing a community-owned resource database that we hope to share more updates with y'all in the coming years. That's all, and you can connect with us on our website, social media, newsletter, and here's our staff contact information. We are currently expanding our staff team and putting out part-time positions in the winter or early 2023. I'll drop a quick feedback survey in the chat so that folks know how to connect with us, and also you can ask questions or offer collaborations or resources through the feedback survey. With that, I'll hand things over to Michaela, and Michaela, sorry I took up so much time.
No, thank you. I appreciate you. Thank you, Luca. I also want to just leave a little bit of time for Luca. I love Katy and Luca so much. They're just wonderful people to work with, and their organizations are so fantastic. I do want to leave a little bit of time for people to ask Luca questions. I feel like Squish is such an important organization that it's worthwhile.
Oh, thanks, Michaela. All right, I'll take questions either in the chat or out loud. Jen says, is Squish on Twitter? Twitter is a beast to run, and so we do have a Twitter account, but we haven't been able to make the most of it. So right now we're focusing on Facebook and Instagram until we have the capacity to effectively engage with Twitter. Okay, Michaela, over to you.
Awesome. Thank you so much. Gosh, where to start? Do I have co-hosting ability to share my screen too? I'll do that here. But to start off, I am Michaela Joy. I am the new interim executive director over at Metro Trans Umbrella Group. We are a grassroots nonprofit organization that is intent on bringing together the trans community, and I think are falling into bringing together the LGBTQIA community in St. Louis. I think it's something that really needs to be done. I think Katy and Luca really set the stage for what LGBTQIA youth go through, and definitely highlighting what trans youth, trans adults go through. I am a former trans youth, closeted trans youth that grew up out in West County here in Baldwin. And for as wonderful as our city is and the suburbs, and I really have a lot of deep connection and love for this city. The work that we're doing out here is rare. There's not a lot. I feel like there are certain lines or intersections in St. Louis where it's much harder to find growth and to find people moving in the same direction of, I would say, like greater acceptance and hope to learn and listen. I want to share my presentation here because I feel like that's such a big part of, let's see here. Oh, actually, I have a new computer and haven't updated the permissions for Zoom. Let's see if this works. All right, I think this should work. Can y'all see the screen now?
Yeah.
Great. So, yeah, we are out in South City. We've been here since 2013, and oh, it's giving me waiting room privileges. We've been here since 2013. It's really been a big effort by a group, a community, from Sayer Johnson, our executive director, who's exiting. He's actually leaving here at the end of this month. So this is a big transitionary period for an organization that's been around for such a long time, with a lot of programs and services. You know, I've come into this organization within this year, really. I started getting services from MTUG in January 2020. And most of that was meeting trans people and support groups. And the pandemic, I would say, really affected, especially affected trans and queer individuals in the city, accessing community, accessing services. You know, we operate a community center here in Benton Park West, and we fulfill a lot of basic needs, as well as gender affirming services like name change consultations, adaptive wear or gender affirming day-to-day life with tucking underwear and binders. When the pandemic happened and lockdown occurred, it was really important for us to pivot our food pantry to be delivery. So it became inaccessible for people to come to our actual center here and reach the food that we have. So we turned our community center mostly into an outreach center. With Pride Center closing this past year, we are now, as far as I'm aware, the only LGBTQIA center in our community, period. You know, I think we've really done a good job servicing the queer and trans population. I say queer kind of broadly, but I think it's time for us to be a lot more intentional about what communities are out here and where is their access to these services that we can offer. Part of what I've experienced here is I think earlier there was a question in the chat about intersectionality that Katy mentioned. It's very difficult for, I'll say this, I'm a marginalized person, and being trans and being a mixed person, I still have privilege. I still have the ability to be here. I still have the luck to experience what I experienced. Everybody lives kind of different lives. Excuse me for a second, because this is something new for me. The unhoused population in St. Louis is horrible. It's really bad. And we do not have the shelters or the city acceptance to be able to live our own lives. So people come here and with our community center undergoing a lot of change, we've not had the resources to serve all of the people that need help. I wanted to come here and do a presentation on things like pronouns and gender identity. But having gone from a very national perspective on what's afflicting LGBTQIA people to a very local lens, from my experience of St. Louis, it's way harder out here for us than it needs to be. I think if anything in this role, what I'm hoping to do is really take the warmth and the philanthropy that I felt in this city and bring the attention to a community that I exist in, that a lot of us exist in. A lot of us exist in adjacent or closeted or having, children or friends or family who are in these communities. And I'm so grateful for the work that Katy does, that Luca does, and other people do in the area, especially to help get basic rights. I had a meeting the other day with someone who works as a federal official, and I was explaining, we do not have the same sorts of protections in Missouri that other people would have in Illinois. There are not the same sort of rights here on this side of our river as there is on the other side of the river. And I think it's really important for people to feel the impact that it's having, because it becomes such a polarized conversation in media, in circles. And I'll tell you from my boots on the ground here, polarization afflicts all groups. I mean, it is people coming and pulling to different sides. It's very hard because I think such a huge part of what's going to help us move forward and progress as a community, and not just my community here. I'm talking about Greater St. Louis. For us to move forward, it has to be finding a shared language. It has to be finding just the ability to listen. Part of even my presentation about pronouns, people tell you their pronouns all the time. I think there's such a huge concern that I've felt on people who don't have the same sort of allyship or understanding that these pronoun things are new, and I don't have pronouns. It's what are we actually talking about? This is are you willing to have a conversation with someone? What we do in our advocacy work and our training and education is we go out and talk to organizations and basically say, treat trans people like people. It's that simple. We can talk about gender expression, gender identity, sex assigned at birth. These are all different concepts. They're all related and interlinked, but gender identity does not equal gender expression, does not equal sexual expression or orientation, does not equal who you are as an identity, as a person. That's something that we each decide. We have different identities, whether it's our religion. I consider myself Catholic because I was raised Catholic, but in their language, I'm lapsed. I say I'm a cultural Catholic, and my aunt, who was also Catholic, converted to Judaism recently. And I think that's it's been fascinating even to be in this space and hear from y'all at the beginning, just about things you're concerned with, hearing about, feelings on abortion and views there, to have more ability to communicate with each other across these groups, these little silos that we live in. I think that's the most important part here. And it comes from even experience here in St. Louis, code switching. It's different from in the county and in the city, depending on who you interact with. As someone who's half Filipino, my family grew up on the other side of the river in St. Charles, that other side of the river, not the other one. And it's interesting to code switch between a St. Charles, more rural area, and a Baldwin West County area, and then going into the city and working at a rental property in Arsenal here with my stepdad. These are all different areas and have different cultures. And the ability to work and walk through all of them, I think, is extremely important. And that requires some discomfort. And if I'm going to ask any of y'all to do anything here, aside from, of course, donate and support us and resource and plug all that, please just challenge yourself to be uncomfortable just a little bit. because that's how we're going to grow. That's how we're actually going to learn things, is if we're uncomfortable. No one's learning anything when they're comfy and sitting in a nice, yeah, it's having the hard conversations, it's being willing to listen, to separate that reaction and that feeling and that emotion from each other. We do a lot of trauma-informed work here, because the comorbidities, the things that people have, you know, we're trying to just get gender-affirming healthcare. This is just so we can express ourselves in a way that feels better. I tell people informally that hormones are the best antidepressant I've ever taken. I mean, it certainly helped me feel even just better in my own body. You know, forgetting all of the other like things that the media tends to focus on with transitions, like that's really what this is about. Like, to be able to live from, often, especially from my own experience as like a closeted individual who came out in her 30s, the ability to get healthcare, the ability to get mental health resources. I finally have a good psychiatrist that is amazing, but we have psychiatrists and therapists and such who don't take insurance because of the systems in place. And I'll tell you, there are a lot of people that we serve, a lot of clients that we serve, whose money is used better, in their opinion, outside of things like healthcare. We have people who are going to one of our partners, Planned Parenthood, that we have a grant with to provide gender affirming care in the area, in St. Louis region. These are people who go and often don't have primary care doctors. So they're seeking gender affirming care and not able to tend to the general ailments that they may have, the underlying conditions they may have. And Planned Parenthood does not do primary care. So where does everybody go in order to get these accesses, get access and get these resources and services? And a lot of them come to us. And the reason that I get so emotional is, especially for my unhoused community, I get to tell them, great, I have this list of shelters that I can call that you are federally protected from discrimination. But that experience I've heard is terrible. This place might be a little better. This place, stay in line for a while and hopefully you'll get a bed. Also, you might not get an area where like you will feel affirmed in your gender and have like that level of like psychic safety. So instead, people go and they sleep at camps, and we provide them tents and sleeping bags and pillows and food. Our pantry services are such an important part of our organization. From our food pantry that we do deliveries currently once a month. Y'all want to adopt us and help us do a food drive and deliver food. We need that in our community. To our clothing pantry, we have Alex's Closet, who was a former community member and staff member who is no longer with us. And we created a memorial in their honor, which is a free clothing closet downstairs. People bring in their donations, whether it's their secondhand donations or Dillard's comes by and drops off a bunch of coats. We give these clothes to people for free. It's like walking into a Goodwill, but instead of like purchasing a bunch of stuff, it's like, great, try this on. Do you like it? Wonderful. Thank you for visiting. Go home. Please take as much as you want, because we get more clothing donations than we have space for. So I just had a conversation to try to expand that closet to be 75% bigger. It's still not accessible, still in the basement in South City. So we have people that it won't be able to serve. You know, these are the current challenges we're facing, is trying to get people services they otherwise can't access, give them to them while understanding the intersections they live in, the challenges they may have when it comes to finances, even the ability to comfortably go and exist in a store. Like these are the day-to-day, you know, death by a million paper cuts that I think our transgender community is going through. To be cognizant of the time, I skipped a big portion of my actual presentation here, but I'll just encourage y'all. Y'all want me to come back to do an actual Trans 101 presentation on pronouns, on gender identity, I'd be happy to do that. And truly, like 9 in 10 people don't know a trans person, and now y'all do. We are local. The 3 of us here at these organizations too, like we're doing this work and we're here in St. Louis. We're looking for community to work with, both grassroots, boots on the ground, remotely, to be able to assist people in their own environment where they feel safe and comfortable, and the higher level when it comes to our actual legal systems and government systems to be able to fight for our basic dignity. You know, I like to ask people, like, who deserves dignity? That's a tough question for me to think that there's any other answer than everyone. So please, you know, do all your wonderful work. Keep us in mind. We'll be here. You can access us on Metrotrans, St. Louis Metrotrans, sorry, stlmetrotrans.org. You can email. I'll post my email in this chat. You're welcome to reach out to me directly. I will be bustling away here at the community center trying to staff us and get us operational to open from 1 day a week to hopefully 3 days. And I hope in a year we can be a 5 to 7 day community center, but there's work to do beforehand. So thank you all. I really appreciate you, and thank you again to Katy and Luca for starting us off and giving me the time and space. Appreciate y'all.
Jen, did you want me to close out? Well, I so much, my heart is just goes out to you. I thank you so much, Michaela, for sharing and being open and vulnerable with us. We would love you to come back. That would be my first thought, because I would love to learn more from you. I mean, this has been truly an incredible learning experience. And I want to thank all three of you, Luca and Katy and Michaela, for sharing, for the work you do every day. Just incredible work. And I know we want to continue partnering with you. I have like so many questions, but we are totally out of time. I think we should connect again, and again, would love to have you back on to learn more from you. I think a lot of us, you know, in the NCJW community are happy to be uncomfortable. We want to learn. Sometimes we just, you know, we're afraid to talk. We're afraid, you know, we're a little afraid to say the wrong thing, or, you know, but I know that we all, we really want to learn and support and partner with you. So, with that, I will just say thank you all for coming, and we hope to talk to you again soon. Anything else, Jen, that you want to add?
No, but I would love to talk to our resale shop. I'm going to talk to them about getting some stuff over for Alex's closet at the very least, and then, you know, talk to our board and staff about doing some more. So thank you.
Thank you so much. That'd be fantastic.
Yeah. And thank you all again so much. We hope to see you next month and on the 22nd for the events I talked about. I do want to just one quick thing. I'm going to be sending out an email with an evaluation. If you would be kind enough to fill that out, that would be terrific. And again, thank you for joining us today. And thank you, Hillary, and thank you, Katy and Luca and Michaela, so much.
Yeah.
Thank you,
And stay
everyone.
cool out there.
Keep in
Thanks
touch.
for having
Take
us.
care.
Take care. Goodbye.